Hey, this is Jason the PT, and if you've been considering dry needling, here's everything you need to know. Welcome back to Around the Treatment Table with Jason the PT. All right, welcome back to another episode of Around the Treatment Table with Jason the PT. My name is Jason, and today we're going to be talking about dry needling. I get a lot of patients that have questions or considering actually doing the technique, so I want to put together a video so you can fully understand what it is all about. So let's get to the questions. The first question I almost always get is, what is dry needling, and is it the same as acupuncture? Well, no, they're not similar. They're similar, but they're not. There's differences in their technique. So, first and foremost, acupuncture and dry needling do use the same needles, but how they're used and the thought process behind why we're using them are entirely different. Dry needling involves taking a thin monofilament acupuncture needle where we tap it into the skin and actually pissing it down to the muscle belly to allow a release of the myofascial trigger point. Whereas acupuncture is tapping a needle into the skin and is more based around the Chinese philosophy of aligning energy and meridians. So there is a big difference in technique and thought process there. The next question I get a lot of is, what is a trigger point? Well, a trigger point is muscle tissue that's caught in a contraction that can't let go. So think about it like doing a wall sit or a plank. You're in that position and your muscles are tensed, and you can hold it for a little bit, and then what ends up happening is the tissues start to shake, they start to burn, and then you collapse. Well, think of a trigger point, but it's a piece of that muscle that's caught in a contraction. And when a muscle is in its contracted state, it's hard to get blood flow into and out of that contracted muscle. So therefore, the tissue goes into an energy crisis. And amongst other things, it really becomes deoxygenated and acidic, and that tissue goes into energy crisis. And this lowers the pain threshold. So that's what a muscle trigger point is. Third question I get is, what can dry needling treat? And basically it comes down to just about any myofascial problem a patient may be having. Sometimes it's tension headaches are one. A lot of people come in for upper trapezius problems, mid-back issues. Anywhere there's a suspected myofascial trigger point, your practitioner will kind of push around a little bit and figure out where you're having your pain, and then they do the dry needling. There is some evidence that dry needling may also help with tendon issues, especially a chronic tendon problem, because it can stimulate some tissue healing. Next question I get is, are there any contraindications to dry needling? And there are. Anybody that has a bleeding disorder, meaning they can't get their blood to coagulate, that you wouldn't want to be sticking needles into that. Pregnancy is kind of more of a yellow flag. There's really no evidence that being pregnant a pregnancy can be affected by dry needling in any way. I mean, you wouldn't go over the abdominals, for that. But it is kind of a yellow flag, and it really depends on what the patient wants, the patient's belief systems on that. Cancers or any sort of active infections, I wouldn't do dry needling for that either. Next question is dry needling safe? And generally, yes. I mean, we are inserting a needle into the body, and there's some places that you generally wouldn't want to put a needle into. Like, one of the biggest risks are what's called a pneumothorax, and that's if the needle actually accidentally goes into the lungs. Now, I've never done that to a patient, and I don't plan on it. But when you are needling over the thorax and over the lungs, you need to take a little bit of extra care. But with proper technique, it's a very safe treatment for those types of problems. Generally, after that, though, patients may just be a little bit sore, but and you might have a little bit of bleeding, but nothing crazy. Next question I always get is, well, how does dry needling work? Like, how does it help? Well, the exact mechanism isn't actually known, but there are two schools of thought as to what dry needling does to a trigger point. And the first one is you tap the needle into the trigger point, and some people say it's the metal in the needle, but effectively you may get this involuntary twitch response where the muscles kind of just like shake themselves out of that contraction. So we're not 100% sure what will cause that twitch response. The twitch response generally isn't needed in terms of whether or not dry needling was successful or not. Another school of thought, it's almost like bloodletting of sorts, like popping a pimple. You got all this junky old blood within the muscle. By kind of tapping into it with a needle, you're releasing that old blood, letting it get out of the muscle fibers, and allowing new blood to come in. So those are the two schools of thought. The evidence has shown, though, when we've taken blood from a trigger point pre-needling, to post-needling, what we see is a significant return of oxygenation and a return back to basic from being highly acidic in about 2 hours. And that is thought to help kind of calm that tissue down and get it out of its energy crisis. Another question I get is, what kind of training do you need to have to be able to dry needle? Here in the great state of Illinois, you have to have over 50 hours of direct training for dry needling, and then you have to demonstrate 200 successful treatments under the general supervision of someone who is already certified to dry needle. One of the other big question is, does dry needling hurt? It's not pleasant, for the most part. I mean, it depends on a lot. It really depends on the patient's perception. Usually when I tap the needle in, most people don't feel much because it is a very thin needle. When I do hit a trigger point, it's almost a weird kind of metallic-y muscle cramping sensation sometimes. You'll just feel that muscle twitch. And it can be a little bit uncomfortable, but I've never had anybody come back and say that was absolutely horrific. But yes, it can be a little bit uncomfortable, but the results that patients get afterwards, they will tell me it was well worth the discomfort that they went through. Here's a quick demonstration video of the dry needling techniques at the gluteal muscles. So here's an example of needling the gluteal muscles. What I'm doing is feeling around for the trigger points, which are a taut tender bands. Once that's located, you place the tube over it to insert and tap in the needle. Withdraw the tube, and then you piston that needle through the muscle belly, driving it down towards the trigger point. And from this, to find it, you may have to redirect the needle a little bit. Generally, patients don't feel when we tap the needle in, maybe just a little bit of a pinprick. And then if we hit the trigger point, there could be a small zipping sensation. Sometimes it's a little bit bigger of a flashing sensation. But it's generally well tolerated and maybe a dot of blood. So what happens after dry needling? Most people will be a little sore for about 24 to 48 hours. Some people don't get sore at all. Usually ice and self-massage help. You can take an anti-inflammatory if you feel like you need it, but most people don't get that far with it. But it's generally well tolerated. I do tell people you can go to the gym and you can do some stuff. Just don't make it a PR day. You just don't want to go too crazy because you really, especially in the beginning stages, if you're just trialing dry needling, you just want to see what that response looks like. And one last question I typically get is, what does dry needling cost? And will insurance cover it? When we do dry needling here in the clinic, if it is as an incident to a plan of care, like if I'm working on something and I feel dry needling would be beneficial in that plan of care, I can make that work under insurance generally. If the patient is coming in and it's a standalone treatment that they want, we do have a cash pay option on that. But yes, if dry needling is being done in conjunction with a plan of care, I usually can get that covered. But if you just want me to come in and needle you, we have cash pay options for that. So hopefully that helps if you're considering dry needling. Obviously, if there are any questions, you can always shoot me an email or a comment in the video. Obviously, please like and subscribe, and I look forward to seeing you down the road. Thanks a lot for tuning in this episode of Around the Treatment Table with Jason the PT.